Let me first say that this is for continuing education, and let me do.
Did you try star 2, Donna, to record that, or?
To make sure that you get the continuing education hour, so contact Betty after that. The purpose of this discussion is to provide better understanding of the Rocker Sole footwear with clinical applications of the Rocker Sole technology. So I hope that I will bring you some information today that you can take and use as to which Rocker Sole you would applicate with certain types of foot characteristics, and understanding what are actually the Rocker Soles doing.
Are you there, Donna?
Yes.
I didn't hear it record.
Okay.
It's not recording at this point, so. No. Let's see.
No.
Okay, yeah, hit no. Well, for some reason it didn't come on and say it was recording, so I guess it must be all right. We'll let it go. We have a recording of the first one anyway, so we'll just let that go.
Okay.
Okay, thanks.
Thank you, Tracy.
All right.
Rocker shoes have been around for a long time. As a podorthist using a variety of shoes to help people with foot problems, Rocker Soles can be, for one, a negative heel to help unload the forefoot like an earth shoe, a double rocker to help relieve midfoot arthritis or nodules or Charcot breakdown, a heel-to-toe rocker to help replace lost motion at the ankle joint, such as an MBT, or a hybrid like a negative heel forefoot like a Chung Chi that is uniquely accomplished results for a variety of foot pathologies. And I'm going to be discussing some of these foot pathologies. First of all, you've got to do a proper foot analysis, understanding what that foot is actually doing, static and dynamic. A gait evaluation. You want to watch them in their normal shoes and also barefooted. Proper foot selection. Proper shoe fit. The proper fit is so important as to how pronounced the rocker can be accomplished. And arch supports or inserts. Some of the rocker soles actually can throw you into pronation. You may need to support that medial longitudinal arch, and I'm going to show you some cases where that had to be done and cases where it was not suggested. Shoe shape refers to the shape of both the sole and the upper. Proper fit is achieved when shoe shape is matched to foot shape. Okay? Foot Solutions has been selling the wellness and rocker sole shoe technology for the past 9 to 10 years. Foot Solutions has been a benchmark in the U.S. as the most experienced business and network in educating, initiating research, which we are all involved in there at Foot Solutions with a college that's close by to the corporate office. That research should be ending around June, and I think it would be very beneficial for you and to help educate people within your medical team. And establishing the benefits of rocker sole technology. And let me say, I am so proud of all of you involved in Foot Solutions and understanding all of the technology that's available to you as far as the different types of rocking effect, whether it be an increased toe spring or a heel-to-toe rocker. There are a number of your shoes that have been selected by very qualified people there at the corporate office in offering so many different accommodations for different types of foot characteristics. So rocker soles originally used for painful feet, such as diabetic feet, ulcers offloading, arthritic feet, triple arthrodesis, ankle and knee fusion, limited range of motion of toes, and also ankle, knee, and hip issues. So rocker shoe modifications have been around a long time in the podorthic field. I have been involved in the podorthic field since 1976, actually doing podorthics that I didn't realize doing podorthics since 1974. But I've found that a benefit of a bilateral rocker sole modifications continues to be implemented today. And back in the 70s, a lot of times you would see case studies, especially with forefoot deformities, toe deformities, where we used just a toe-off rocker, that we only did the rocker sole on one foot. Just like the cam walkers, the bracing, the casting techniques that's used for immobilization of the ankle and foot. We have seen so many low back and knee issues that are contributed to only having a rocker sole on the affected side, and it's causing more issues if you do not have a bilateral rocker sole modification. So when we talk about rocker soles, we're balance, and you're going to see some case studies where balance and postural alignment is affected with different types of shoes. Joint stability is one thing that the reason why that we used a lot of the rocker soles is improving the joint stability. Muscular strength, activating the quadriceps and the gastrocs and stabilizing the knee. We did this a lot with negative heels. This has been years ago. Enhancing performance. So we found that if you exercised, walking in a bilateral rocker, heel-to-toe rocker effect, it did help engage faster twitched muscles. So your speed was enhanced, plus enhancing the stability and the strength. So rocker sole shoes tend to engage the core muscles. Anytime that you are rocking the foot, you are affecting the pelvis and the waist area. And this can improve proprioception as to where you are in space, the positioning of your foot, the neuromuscular effects. The term proprioception refers to a sense of joint position. Proprioception training is highly common in rehabilitation of injured joints. So, but it can just as easily be used to prevent injury. We use, I know in working with a lot of head injuries, CVA patients, post-polio syndrome, MS patients, proprioception is the key core or the core of the training effects in trying to regain the feel and their control of that limb in space. So even a strong ankle can sprain when running on uneven ground if the runner hasn't trained the neuromuscular system to react appropriately. So slight deviations in terrain require slight adjustments and balance to avoid injury. The rocker shoes can substitute for the loss of foot and ankle rocker actions, but the patient must have retained sufficient strength of hip and knee extensors and ankle plantar flexors to provide the required limb stability. Now we're talking about a negative heel rocker, just a toe-off rocker on this. Because whenever you are dorsiflexing or actively engaging the extensors of the knee and the ankle, you are shortening the anterior part of your leg. So that means you're getting a lengthening posteriorly. Okay? Rocker soles on shoes have been shown in a number of studies to substantially relieve pain associated with a variety of foot issues. Depending on where the rocker is placed on the shoe, it can provide different benefits and we're going to break down different tilts and rocker effects. So let's talk about, first of all, the forefoot rocker sole. A rocker placed just behind the metatarsal heads is very effective at reducing pressure under the ball of the foot and reducing motion in the toe joints. We use it for treating hallux limitus or arthritic stages of the great toe and ball of the foot pain. But you can also use it to help activate dorsiflexion. And also you're getting some quadricep activity with this. This is a modified rocker sole onto a Rockport walking shoe. It's called a Rockport Sport walking shoe. I'm sorry. This is a lightweight crepe that I added to the sole of the shoe. And you can see where I've added the crepe, it is less underneath the heel, higher in the mid-arch, and less at the distal end of the toe. So I have actually added a slight of about 4 to 5 degree rock posterior of the calcaneus. Okay, my highest point, the apex, is directly underneath or vertical to the lateral malleolus. Let me go back one slide, and I want you to look at the apex of the toe off, and it is proximal to the metatarsal condyle, or the distal end of the metatarsal. It is, if it hits right on the condyle joint, it causes a jamming of that joint, so you decrease the effect of the rocker effect. You actually are locking in that motion too much. So it has to go proximal. But it is always very effective to have slight rocker effect, and we have found that over the years. A lot of times, years past, we just came down straight, level across the heel base, and then the engaged toe off. The shoe modification rocker sole is about the same weight and height. I'm talking about the shoe modification, as soles commonly found on motion control or stability running shoes. This sometimes seems to be a big advantage over the heavy and thick rocker soles found on the marketable rocker sole shoes now. Some patients cannot afford for their feet to be weighted down, such as spinal stenosis, any type of hip replacements, neurological aspects, MS, anything that they have lost, or any diagnosis that they have lost a lot of limb strength. Neuropathy also falls into this category. So let's talk about the toe-only rocker. P.W. Miner did a study in 2006. Dennis Janessi was very active in this study. The expectations of the study loads pressure proximal to the met heads, stable mid-stance because of the firmness, reduces shock at toe off, relieves forefoot pressure. But the results showed that the first metatarsal head was 10% reduction, and at the hallux was 89% reduction. That's the distal end of the first metatarsal. So the second met was only 42%. And it's because we normally will go into pronation at toe off, plantar flexing the first ray. Then you actively engage as you continue over the toe off, you actively engage the flexor digitorums to help invert the foot to, again, be ready for heel contact during the walk phase. Okay, that's why we see the fifth metatarsal was only 18% increase during this. So it does actively engage that toe off, that flexor digitorum activity. Reduce pressure in the forefoot, especially medial column. Best forefoot relief. But it increased mid-stance time in hindfoot and midfoot. So anybody that has a heel ulcer or a midfoot ulcer, this is contraindicated, okay? Now, with the heel-to-toe rocker sole that you see a lot in the market now, but we used to modify our shoes along this line, and we still do, this type of rocker sole has the thickest point further back on the shoe and can be effective for limited ankle range of motion or arthritis, especially in the tarsal, the subtalar joint, and midfoot of the arthritis. Any type of Lisfranc injury, cuneiform displacement, cuboid displacement. So this can reduce force on the heel and heel strike as the foot rolls faster off of the heel. So if you have someone with a calcaneal fracture, bruising of the calcaneus, this is very beneficial. But if you notice here, from the posterior aspect of the calcaneus down to vertical line right up underneath the lateral malleolus and medial malleolus, that is the control point for the subtalar joint. It's when the cushioning extends past the calcaneus that you lose heel control. So it causes a little bit more stress on the hindfoot, and that's where you've got to be strong enough to control these. Your lower leg muscles have to be strong enough to control the alignment of the subtalar joint.
Donna,
Here again, yes.
Would it be recommended for an arch support to provide that?
Well, I'm going to discuss all of that. This is a modification. I'm just explaining the technology so that whenever we get into some of the MBTs where the satch is further down, you would use it for certain types of foot issues. And orthotic is always beneficial to assist and guide the heel-to-toe mechanics and to control the stresses of the foot, okay? Negative heel, P.W. Miner did a study with the negative heel in 2006. The expectations was shifts the weight bearing posteriorly and accommodates dorsiflexion. So whenever you go with the negative heel and you have a foot drop with a weak ankle or a weak knee or hip, this is what you want to go with and not a heel-to-toe rocker because you offer more control and you still assist in dorsiflexion. And it also relieves forefoot pressures. Now, does this type of forefoot pressure help with neuromas? No, not necessarily, because a neuroma, interdigital neuroma in the metatarsal area, is an end result of something else going on, and majority of the time in the hindfoot or the midfoot. So that's where you would control. If it's controlled behind the ball of the foot, then you do get some relief of neuroma-type symptoms. But the results of the negative heel, first metatarsal head, was a reduction of 7%, which is a lot less than the toe-off rocker. And then Halleck's was 44% reduction, which was the same as the toe-off rocker. The second Met was greater in reduction with the negative heel than it was with the toe-off. So there's a little bit of difference, and it goes back to the type or the characteristic of that foot. Decreased forefoot pressure increased midfoot pressure with the negative heel. It decreased forefoot pressure, but it increased midfoot pressure. So if you have somebody with arthritic stages, then you have in the midfoot, then you would have increased pressure of the midfoot, which would be contraindicated. But that's where midfoot arthritis sometimes benefits with a heel-to-toe rocker instead of just negative or forefoot rocker. So this is a negative heel that we modified with Satch material. And this is an old Rockport shoe that I actually pulled the base of the shoe off down to the distal end of the calcaneus. And you can see here that I have sanded down the EVA material that came with the shoe down at the angle of the rock. And I wanted to incorporate about a 12 to, this actually ended up being about a 12-degree rock of a negative heel rock. Now my firmness is vertical to the malleolus, and that's the critical for the control of the ankle, okay? So this is, and then I incorporated the Satch material, which has memory foam. It's a memory foam, and then enclosed the base with the original sole. So that's a shoe modification with a Satch, and that proved to be very, very beneficial when I wanted to actively engage the quadricep muscles, the vastus medialis, the VMO, the intermedius, and the vastus lateralis. It also will involve the gracilis, the hip adductors, in this positioning, but it assists in dorsiflexion. So then there was a study in 2006, the same time, University of Calgary did the study with Changchi shoes. It incorporates a natural, relaxed, upright position, better alignment, increases circulation. They all increase circulation if they are used appropriately, because you're actively engaging the muscles that need to be assisted. You will always have a shortened stride, but they noticed more of a shorter stride with the 15-degree heel to forefoot rock. And with that rock, it promoted proper gait. So then it falls in, this is in the Class 1 medical device EU. So it reduces joint loading of the ankle 60% and 20% in the knee, but it helped with the push-off in the forefoot. So it actively engages more of an explosive toe-off, because one thing is because it has a firmer heel, control, firmer sole, firmer rock, and you get more of an explosive toe-off strength. So you actually get more exertion of or innervation of the the gastrocnemius in toe-off with this. And one thing is that we found out that it has a higher rock laterally and puts you into pronation much quicker. So you actively engage the flexor digitorum, therefore engaging the posterior tibialis and then into the medial gastroc. Now with that taken in consideration, you can only do that and gain the benefits of that if you're strong enough and your ankle is stable enough to go through this motion. But a lot of times you've got to be concerned about excessive pronation. If it's causing more excessive pronation, you've got to go with a custom firm or semi-firm or rigid orthotic to help control the midfoot.
Hey, Don.
Yes.
Sorry to interrupt you. This is Mike Smith. Is it possible to have the stats that you just went over there?
Yes.
For the Changchi put into a point of sale information? Because when we talk about differences with rocker sole shoes out there, for example, the Reebok, and then also the
yeah, we're going to be discussing all of that. If you don't mind, let's finish, and I'm going to be open for questions at the end. Okay? Talking about the Changchi, and it automatically directs the feet through a stable, natural gait. Now, when I say stable, the Changchi falls into the stable category. And what I've done, I have broken a number of these shoes into stable and unstable categories. And by the stable natural gait, this improves your biomechanical function and leads to a more relaxed, upright position or posture, a more comfortable standing and walking environment for the feet, legs, joints, and the back. Only if you can stand the high lateral firm bar. Now with the MBTs, the Sheffield University in the UK did the study. The body is stimulated to balance itself. Better posture, which they all introduce better posture. Shortened stride, that's all. Satch heel, a softer heel type construction. And it still falls into a Class 1 medical device EU. It does reduce stress on the hip and knees by 19%. But the Changqi reduced stress on the hip and knees, well, actually the knees, by 27%. So there's a difference. Both of these shoes are totally different. It acts as a combination toe only and Satch heel. Outstanding results, of course, which all of these shoes have outstanding results with plantar fasciitis, if the appropriate foot is with the appropriate shoe. So when we talk, let's look at the MBTs. The Satch heel, you can see the increased rocker coming back from the posterior aspect of the calcaneus and going anteriorly, and it actually hits right half of the navicular and the cuneiform. Now that Satch heel is more increased, which makes the hind foot more unstable. But with the heel control, the heel counter on the MBT Sport is firm, and that's what it has going for it. So if you put people in sandals that's with the same rocker sole technique, you have taken away the guide of the hind foot, about 50% of the shoe stability. So looking at where the firmness actually starts is actually anterior to the talus. So that means that this part from the midfoot back to the hind foot actually will affect the hip and the knees. And that it has a little bit of a less toe off. There's more of a negative rocker heel than there is in the forefoot. So with these type shoes, they're always discussing that this is, the Messiah effect is going barefooted or a lot of people incorporate the barefoot running. That is all fine and good as long as you have the control that's needed to withstand the stresses. If your foot has the normal biomechanics and your body has the normal biomechanics to withstand some of these stresses, but I do know that overuse of these muscles leads to repetitive stress syndrome. And I want you just to look at this picture of this person in the sand. If I drew a line from the second and third metatarsal up to the center of the heel, you can see that the heel is out of alignment. So the great toe is severely plantar flexed, going into forefoot pronation, and the hind foot is actually inverted. So if you're into this positioning, you can see where repetitive stress syndrome can become a part of an injury later on. So some unstable rocker soles creates a teeter-totter effect with each step. The low, firmer heel, such as Changqi, helps make a stable foot plant. Then the midsole pivots the foot onto the toe for a powerful toe off. With a regular athletic shoe sole, the shoe bends to allow the toe off, which can create friction and pressure on the bunion area. Stiff walking shoes doesn't bend, but also does not pivot to allow a toe off, leading to a flat-footed walking. So if you have a pes cavus foot or a high arch foot in a stiff walking shoe is contraindicated because it will cause more stress to the mechanics of that foot. The rocker sole enforces a proper walking motion of heel plant, roll through, and toe off. So walkers should be able to increase their walking efficiency and speed with a rocker sole. Yes, that's true, as long as they are appropriately fitted for that foot, for their foot, with the type of rocker technology. So the shoes requiring good balance might make some people fall due to certain medical issues. In certain cases, because of biomechanical or physical limitations, these shoes might not be suited. So please, please evaluate your client, your patient in front of you to know whether or not a rocker-type shoe would be beneficial. For the right patients, we have seen significant benefits. I have recommended them to patients after ankle surgery or to arthritic patients with limited range of motion. With the rocker bottom, there is less impact through the extremities and a better transfer of energy from heel to toe. The technology used in the rocker soles helps your body perforce, stimulates, and exercises the skeletal muscular system, particularly the muscles in your abdominals. I can't even say it. Now, I've had a long talking today. The buttocks, the back, and legs and ankles, thus reducing stress on your joints and back. This is all true if you are able to take on the dynamic mechanics of heel-to-toe rock. Over a period of time, it actively re-educates your foot. The new gait enhances your posture, reduces lower back pain, and improves blood circulation. And breathing patterns allow more oxygen into the body. So when you improve your postural alignment, you're going to improve muscle tone. Then you improve blood circulation. If you improve muscle tone in the thoracic area, and your postural alignment is improved, you're going to improve the oxygen flow within the body. It's a given. But not all of these shoes reduces low back pain. And that's why I want to get into you understanding which shoe would you go with certain types of foot problems or characteristics. Potential benefits, the shoes have prevent injuries as well as improve core stability, which we talked about. Benefits of proprioceptive training and physiological effects of rocker boards and wobble boards on muscle retraining and musculoskeletal rehabilitations. I have been able to see the benefits of the rocker sole shoes with clients that have suffered a stroke, nerve damage of the lower leg, drop foot, they're able to transfer balance, improve coordination in a dynamic way, and through integrating additional therapies. And you're going to see some case studies where I worked a lot with the physical therapist, orthopedics, on different dynamics of the shoes to help engage other muscle therapies. That results in a higher muscular stability. It improves balance and the relief of the strain of restricted movement. The best is that these effects are quickly and clearly visible and measurable. The kinetic stance phase of gait is when the normal foot function at heel strike, the foot is slight supinated or inverted as the body moves forward over the foot and pronation eversion occurs, allowing the foot to adapt to the supportive terrain or the rocker mechanics of the shoe. So toe off, the foot supinates again, becoming a rigid lever to facilitate toe off. And this is what you've got to understand, the kinetic stance phase, to understand, does this person have a normal stance? Do I need to change up some of the positioning or the angle of the calcaneus or the metatarsal area to engage other muscles? So when we look at the Chongqing shoe, we're looking at if the spine of the shoe is very good and neutral. It does set usually in a good neutral positioning, but the heel base is level. But when you go up into the forefoot, this is the cuboid just proximal to the elevation of the highest point of the rocker bar. And the highest point of the rocker bar is lateral. So what is that going to do? It's going to engage more plantar flexion and pronation of the forefoot, because naturally we're supposed to go into 15 to 19 degrees of pronation. If you don't, then you have an insufficient heel-to-toe rock. But if you go beyond that point, it opens you up for some overuse injuries. But there are some people that have equinovarus foot, severely supinated, forefoot supination, that we have to incorporate the high lateral aspect. So that's what, from the podorthic point of view, that's when we would use these type shoes. Okay? Let me keep going with this, the application of the rocker sole. There's a critical interdependence between shoe fit as to where, if the shoe fits improperly, you're going to get a totally different rocker effect. The shoe adaptation, whether or not they're able to adapt to the rocker effect, will give you positive or negative results. And then the gait training, making sure that they know to take short steps, heel to toe, don't try to rush, keep your body behind the forefoot, your upper body behind the forefoot. Shoes are very important for feeling better and injury prevention. But confusion as to which to buy, that's where everybody's getting confused. So what I've done is put rocker sole shoes into categories. The unstable shoe means that the instability is in all planes of motion. Frontal, sagittal, anterior, all of the planes are unstable, causing muscles to react, or a lot of times you will hear muscles to work harder. Now, working harder, if they work up to a point to stabilize, that's all fine and good. But if they work harder than what's expected for stability or prevention of coordination, then you lead into problems or injuries. Then there's the stable shoe, which provides a wider sole base. Usually the unstable shoe has a more narrow sole base. But the stable shoe provides a wider sole base, more stable side to side, and helps with overpronation. Unstable ankles, balance stability, and control going forward. So when I say control going forward, you've got to have hind foot control within the shoe to help with the guide of the placement and the foot function. So when we break the shoes down, the Chongqis, the 15 and 20 degrees, is a stable shoe because of the firmness of the sole, the straighter last, the medial lateral heel flare, and the firm heel cup, or the heel counter. The Chongqi anti-step goes into a stable because it is a little softer, but it's firmer material than the MBT, and it's a straighter last. The MBT, the regular sport, and the new low profile is an unstable category, and we're going to be looking at those shoes in just a minute. The Reebok Easy Tone is an unstable, and the reason why it's unstable is that the midfoot is very flexible. When you can take the shoe and bend the shoe in the midfoot area, that's an unstable shoe. RYN, R-Y-N, which is a step off of the MBT, or a step above the MBT, is a stable shoe. But it concerns me that that's being recognized as a stable shoe. It is firmer. The heel rock is actually a little bit more advanced or more profound, but it is definitely firmer in the heel and the midfoot. The Z-Coil, or the ZT, is a double rocker effect because it's firm at the heel, it's also firm in the forefoot, and it's firm at the midfoot. So the rock, and that's considered more of a stable shoe, the Z-Coil. The Skechers falls into the unstable category because of the softness all the way from the calcaneus through the midfoot. And it's a very curved last or shape of the sole of the shoe. Joya is an unstable shoe, but it actually falls in between stability and instability, okay? Because it offers a heel, a lateral and medial heel flare and a straighter last. Fin Comfort, the Finamic, is a stable shoe because it's a straighter last and it is firmer. The Mephisto Sano is a stable shoe. Same reason. The Extensible is an unstable shoe because of the cushioning, a lack of support around the calcaneus. The only firm aspect is the angled rocker sole base at the midfoot, and it is extremely curved. So that makes an unstable shoe. Avon is now selling a low-cost version for Curves workout studios, and it's a break-off of the Skechers and the MBTs, and is considered a very unstable shoe. So when we look at the Chongqi, the 15 degrees on the left and the Anti-Step on the right, we have really some different shoes characteristics. We have a firm heel control, but the heel counter on the Anti-Step is more controlling because of the extension and the firmness medial lateral that we do on the Chongqi 15 degrees. It has more, the Chongqi 15 degrees has more of a negative heel than the Anti-Step. And from the lateral view, you can see that the 15 degrees has more increased toe off, or a toe off rocker, with more decrease of a negative heel. The Anti-Step is also more of a natural flow through with not so abrupt or profound rock, firm rocker at the mid part of the foot, okay? And you can see the difference in heel angle. So when we look at the soles of the shoes, if I draw an imaginary line up the center of the heel of the Chongqi, I am actually coming off of the second and third metatarsal heads. That falls into a straight to a semi-straight last, and or sole last. It will tell you how the shoe will function. So on the Anti-Step and coming right up the center base, it's a straighter last, which offers more stability. Also looking at over to the right at the Fin Comfort sandal versus the Mosquito sandal, the Fin has no rocker effect. It's actually, the rocker effect is internal instead of external. There's no toe spring. There's a slight heel rock. So that's a stiff sole shoe. So you would not want to put someone into this shoe with a pes cavus foot unless they have a custom orthotic inside that actively works with the mechanics of their foot. But they will feel more fatigued in this style of shoe than they will with the Mosquito with a rocker effect. You can see more of the rock at the angle of the rock at the calcaneus and the rock distally at the toes. Now when we look at the Boost with the negative heel, that does have a toe spring, but it is more negative at the calcaneus. But it does offer a medial flare at the heel, but a less flare laterally. So this actually helps, by having more of a medial flare, helps with a valgus positioning of the hindfoot. Also, looking at the Boost, the Athletic Boost, this is considered to be a double rocker. But it's a very soft midfoot rocker. And also, when you take the shoes out and before you fit, look at the hindfoot and see if the shoe is setting up straight, because that will tell you if there's a lot of hindfoot control. You can see the angle that this shoe already sits into pronation. So you're actually going to, the enclosure of the foot will actually guide the foot. And so this shoe will guide into pronation. And the shoe will bend. It's very flexible at the midfoot. So you can see the high raise at posterior calcaneus, and you can also see where the ankle actually sits. The lateral malleolus is actually in front of the tilt. And that can lead to more stress in the medial arch or the plantar fascia, because when standing, you will actually elongate the plantar fascia, causing more stress to the metatarsal area. So when we look at the last of these shoes, the athletic shoe, is straighter last and not as firm in the midsole. This is actually very flexible. But the negative heel boost is more of a curved last. So you've got to be selective as to who you put these shoes on. In looking at the Joya, if I draw a perpendicular line straight down the heel counter, that's fairly straight. Now, the Joya falls into the unstable category, but I truly believe it is in between the stable and the unstable because of the lateral flare, the medial flare. The wider the base, the more stable the shoe. But the Satch heel is actually not as far forward as the MBT. So the more forward the Satch is, the less control the shoe. The less the Satch heel positioning, the more control of the shoe. And I was able to wear this shoe, and I have a rigid right ankle. So, and it does affect my right SI joint. With the orthotics, I actually did okay. I cannot wear the MBTs because I need more of a stable shoe. But looking at the last of the Joya compared to the last of the MBT, the Joya is straighter last than the MBTs. And the way to look at this is to lay the MBT down onto a piece of paper and draw off the medial border. And then draw off the medial border of the shoe you're looking at. And you will see from the medial calcaneus to the medial forefoot, it is straighter than the MBT. So you need more of a flexible foot, more of a control and muscular strength and balance to actually function very comfortably in a curved last shoe. Let's say that you want to do any reshod rocker soles. I used to do this a lot and also fabricate my own rocker soles, where you actually sand down the whole base of the shoe and apply the rocker sole that's prefab. I know that the Apex has put out some of the prefab, the EVA or the crepe rocker sole effects with the tread on the base. You can completely sand down the shoe and put that type sole on, or either incorporate your rocker material and the Apex really modify the shoe to meet the foot needs, and then put the sole back onto the shoe. So with people with diabetic pressures in the forefoot or any type of nodules or deformities up in the forefoot and you're wanting to offload, you've got to have control in the hindfoot, because you can see the loss of toe strength here and the deformity, so I know that they don't have the hindfoot control needed. So no, I would not put them in a rocker heel-to-toe rocker. I would only put them in a toe rocker sole shoe. But in certain cases, I might modify the negative heel rocker sole and offloading the forefoot. This is called a double rocker forefoot. So my double rocker is in the forefoot. I have continued my apex proximal to the metatarsal head, offloading the site, and then I'm picking up my apex distal to that and toe off. So I engage more of an offloading characteristic, even though I have a 5-degree rocker that I have placed onto the bottom of the SAS free time shoe. Any type of these toe deformities where you know there's not a lot of strength, you want to have a lot of midfoot and hindfoot control. And that would be with the orthotics and the shoe itself. With a ankle that is in varus and the opposite side is in valgus, you have got to control, you've got to make sure which one's their dominant leg and which is the affected side. So the affected side's on the left on this case study, so I can accommodate that foot. The right foot is the more severely pronated, and I know that's their weight-bearing positioning, that's their dominant leg. I have got to make sure I have that controlled, and I control that heel-to-toe mechanics. Because if this right foot goes more excessively into pronation, I am going to cause more stress laterally on the left foot, which is right back to where I started. So here again, if I put them into a Chongqi or an MBT or extensible, I've got to make sure that I am controlling the hindfoot on the dominant leg side. Here again, with a midfoot breakdown like a Charcot, an ulcer, or a nodule, or bony prominence, or a stress fracture that we're wanting to keep firm, but to keep the pressure off, there is a double midfoot rocker. Here again, I have a 7-degree proximal to the pressure site and a 7 degrees distal of the pressure site, toeing off to 0 and heel to 0, posterior heel. So this is a heel-to-toe rocker with a double midfoot. So this patient did have enough muscle control to take on the heel-to-toe rocker. Remember, just the toe-off rocker is more stable. Here again is a triple orthodesis with an ankle fusion. On the right, he still does, his ankle fusion is in the subtalar joint. He does have some movement at the midfoot. You can see the severe varus positioning of the right foot. He has been unable to bear pressure onto the ball of the foot. And you see how the heel elevates. Now, the Achilles tendon, most of its pressure is at the styloid process or the base of the fifth. So you can see the heel elevation here. Now, I've got to make sure, do I have enough range of motion and dorsiflexion to take on a negative heel rock to rock him forward if I use the Chongqi or the MBT or the extensible? So I tried on the 15-degree Chongqi, and you can see here that he's still in severe varus. His right ankle, the lateral malleolus, is way off of the base. That's unstable. I don't want him in that positioning. But I know that the dynamics of the shoe would be very beneficial. But if I put him in the satch heel, the softer heel base, he would completely collapse even more off of the base of the shoe, so I could destroy his knee and hip. So I want to go with a firmer shoe, but I want the rocking technology. So I went with a custom ABS, UCBL, with a calcaneal cuboid block. So I am having more contact laterally with a high lateral flare to help initiate the guide of that rocker effect. And remember, the Chongqi rocker is higher, it's a maximum at 15 degrees laterally than it is medially. Now this is him in the Chongqi, which is more appropriately aligned with the orthotic. This is him in, I found that the all-leather shoe offered him more stability than the Chongqi with the mesh around the calcaneus. So there again, needing more hindfoot control, even though his ankle is fused. Now this is the first time that he has been able to stand, he states, more level and more balanced on both feet. Just taking his left step, This is his unaffected side. I like the alignment that is occurring here at the left ankle. And I like the toe-off phase on the affected side. So I have accomplished what I'm trying to do. And I have made a difference in his daily routine and his life. This is another case study of a patient that was in a car accident, hit by a drunk driver, and actually almost lost both legs. Has had 17 surgeries bilaterally, not bilaterally, but totally. The right leg functions a great deal shorter. I saw her approximately 4 years ago, initially, in trying to heal an open wound site at the medial aspect of the tibia. And it was due to the valgus positioning of the ankle. So once I stabilized, I went with a UCBL type orthotic and a straighter last shoe, which is the New Balance 992s. And they also make the 588s that are extremely straight. With the 1122, 1123, 1124 now, I believe, the heel was too raised, too high. I like the straight last, but the heel was extremely too high because it actually would shift her weight too much forward. But she came to the Foot Solutions site at the corporate center a year ago and was having, everything was doing great until months later she began with an onset of right severe heel pain. Diagnosis being plantar fasciitis. But I really feel like it's the mechanics, and I feel like that it's her knee and the hip that is actually leading to some of these issues and the instability of the ankle. Now, at this time, she has not undergone an ankle fusion. So the doctor did not want to do another surgery because of so many that she's had. He wanted to try the shoes. And she does have a rigid ankle. It is not fused, but it is rigid in areas. But you can see the positioning of the ankle. The ankle is in valgus, but the hindfoot, the calcaneus, is slightly inverted. So we have a complete disruption here at the subtalar joint. And you can see from the anterior view the angle that is being positioned. So by looking at her scans, you can see how that the right calcaneus and the cuboid actually displaces. Okay? Now, she cannot use the forefoot. So if she cannot use the forefoot, she cannot rock forward and align. She is staying right on the calcaneus way too long. So I do want to engage something that would reinforce the cuboid site and shift her weight more forward into the ball of the foot to help offload the calcaneus much quicker. So I started out by using the toe splints just to see how strong the midfoot and the intrinsic muscles are. Standing, now you can see that you did not actively, this is dynamic, did not actively engage the toes by using toe splints, but it did help with the alignment of the cuboid. So now, finding that source, going back to the previous slide, I felt like that if I reinforced by padding in this area, calcaneonavicular, calcaneocuboid, would that help shift and guide her foot onto the ball of the foot and offload the calcaneus? So I placed my pads in those critical areas along with the toe splint, and immediately she does feel less pressure on the ball of the foot. But this is before the padding, and you see the slide. Now after the padding, now you can see how I've engaged the forefoot and the alignment of the whole foot engages. So I do know that I want firm heel control, and I want a firm rocker sole that is higher laterally to pronate the forefoot. So I put her in the Chung Chi 15 degrees. She felt very comfortable, did not feel like she had to overwork the right foot. But what concerned me was that left ankle, because this is her dominant side. That's where she puts all of her stress. So by going with a UCBL abs rigid orthosis, accomplished that controlling the pronation on the left, and then with a UCBL calcaneal cuboid abs on the right. Accomplished her, and she's done so well. The doctor felt like she had improved so much, and he was very, very pleased. And he loves the technology and the dynamics of these firm rocker soles. He feels like that the soft rocker soles, the sash heel is a fad, but he likes the dynamics of this. Working with CBA patients and with a balanced pole walking program, this is a man that I saw that I loved working with. This is after wearing the Chongqi shoes. He had a severely inverted foot with drop foot. On the right, on the affected side, the CVA was on the left side of his brain, effects causing numbness and paresthesia on the right. His right arm has relaxed tremendously. Going to this case study is the same characteristic where the affected side is the left side. The brain aneurysm was on the right. And getting up and out of the chairs was very unstable for her. She inverted the foot with severe flexion, plantar flexion of the forefoot and the toes. You can see how that the neck and the shoulders, the contractures in this area. So I worked with the physical therapy and the pre-med students there at UAB in Birmingham Medical School, and this is the case study that we did. I modified her shoe with a 7-degree rock. The apex is at the lateral fibula of the rocker, and firmness, and then toe off, and I added a lateral stabilizer with a slight lateral flare. Then intrinsically, within the shoe, the custom orthotic, I used a negative heel effect with firmness and rocking with a cuboid block and rocking her into plantar flexion, which is exactly what the Chongqi shoe does. This is her after wearing the shoes, and this was after a 12 to 16 week period. This is before on the left, but look at the arm and the foot positioning on the left. I mean, this is the before on your left, and on your right is the improved positioning. And they were able to do more shoulder range of motion. She became more active with the arm, and that all goes with balancing the foot. That's all we did differently, and the rocker effect. This is a teaching golf professional from Pennsylvania that she was having a lot of low back pain, and I suggested a rocker sole effect. She had called and asked me about the MBTs, and I told her, sure, go with it, because I felt like that her hind foot was stable enough. She developed, after about 7 weeks of wearing the shoes, she developed right heel pain. She had never had heel pain before. Her back felt better, but no, the heel pain was excruciating. And you can see the lateral positioning of or the inverted positioning of the right heel. You can see that we see the first ray, and it is elevated. Now, looking at her scans, she's putting less pressure on the right calcaneus, and the right calcaneus is the affected part. All of her pressures in the forefoot, but you see how the heels are severely deviated away from the center of axis on both feet. So by looking at the scans and looking at her shoe, she set on the shoe more laterally, more inverted or supinated. So that told me that there is not enough control. She actually needs a little firmer hindfoot control. But I also noticed that the callus formation is laterally on the fifth, and there's no callus or weight-bearing pressure at the great toe. So I know that she's not locking in the hindfoot by plantar flexing that first ray. So just by, I reinforced proximal to the third, fourth, and half of the fifth by her scans. This is before, this is after. Now she's able to bear weight, and you see how much straighter the alignment of the foot is. Even the left aligned up with the hind foot. So there's a lot more instability on the right side than there is on the left. So by taking her out of that shoe, and I actually put her in the Changchi anti-shot step, and she has had absolutely no problems because it is a firmer shoe. Right heel pain, this is at one of the regional meetings, my educational meetings that I have recently done. A patient came in and was having heel pain with fibromatosis, nodules along the plantar fascia on the right foot. And just showing you her foot characteristics with the valgus deformity and the stress. And also her profession is cosmetology. So she is standing in one position majority of the time, and she has sandals on at this time. But through the evaluation, I had her to try on the anti-step, and you can actually see how that, and this is with no insert, how that does help align the hindfoot because of the heel control and the firmness. Now this is her standing without her shoes on, and you can see the forward motion and the positioning from the waist or the iliac, the greater trochanter all the way up to the anterior shoulders. That should line up at a straight line down over the lateral malleolus. With the shoes on, you can see how much straighter the line is. So by showing her this with a digital camera, she immediately thought, said, I have so much neck and shoulder pain. It's tremendous. Her foot problem can be so related. So by showing her this and her visibly seeing this, it was like, I want the shoes, no matter what. She bought the sandals, she wanted the shoes, the whole bit. But there again is appropriately putting the right shoe on the right foot. This is a patient that has hallux valgus rigidus, hallux rigidus. And also it looks like that she has had a fusion in the past. So by going with, and this is the lady that was actually in the Skechers, and she works at a barbershop here close to me, and I saw her and went in and asked her if I couldn't take some pictures after while I'm doing this session. The difference in the Skechers shoes, it does offer a little bit more of a flare than the MBT does. Not much, but it's a very soft midsole. And you can see that the Satch material is just in front of the calcaneus, and it goes all the way through the midfoot to proximal to the metatarsal head. So this is a very soft shoe, and when you have a soft midsole shoe, it increases dorsiflexion, but if you don't have the strength in the toes, you cannot go forward. And if you don't have the strength in the toes to toe off because it's all negative heel, then you start developing more knee problems. And we're seeing more, I'm noticing people that I'm talking to are having a little bit more knee stress, inferior patella, and a little bit of hip flexor stress, because those that are not strong enough in this shoe has a tendency to lean more forward to try to enhance that toe-off characteristic. Now, last, I wanted to show you my nephew who has been in South Korea for a year. He's Army Ranger trained, and he's Special Services. He's been with me the past 10 days due to injuring his back, running a 14-mile run with 75 pounds on his back. And he does wear insoles. The boots that he was in was slightly broken down, and I feel like that's actually what enhanced some of this problem, because he's used to doing that type of training. So the Army gave him a leave to come and work with me for 10 days, and now he's back. He does have a herniated disc affecting, and I'm going to give you a little history, affecting the left side, but the right side is more rotated. So this is him. I wanted to just take all the different types of shoes, and for you to make your own judgment. I love the Rocker Sole technology. It will always be around. It is not a fad, and they are can be used so effectively if they're used in the right way and the right foot. So looking at, I want you, through these studies, I want you to look at his chin to the sternum, the neck, the angle of the neck, the roundness of the shoulder, the arm hang, the hands in front of the anterior iliac crest, the angle of the pelvis or the buttocks down to the floor, and the flex of the knee. The more that the hip is beyond or behind the heels, the more flexed the knees have to be, okay? So keep that, and we're looking at the lateral curvature here. So the first thing I did was putting him in the MBT, the sport. So this is him standing on the left with no shoes on, and the MBT on the right. Now the difference I did notice is the tilt of the chin, the angle of the neck, slightly straighter, not very much. The pecs is he's much more contracted on the left than he is with the MBT, so he does stand up a little bit straighter. The hip, the buttocks down to the back of the heels is straighter. So I know that it does offer some postural alignment improvement. Now from the anterior positioning, it really doesn't change anything as far as the straightness from this angle. And you see more pronation on the right foot and the forefoot abduction. Okay, and a little bit more contractures of the hands, which always shows some instability. And he states that he felt very unstable in the shoes, and it was very uncomfortable to his back. One thing is because his back is very weak, and he needs more stability, because with a type of trauma to your back in this instance, you've got to have control. You've got to control the alignment of the heel. The heel is so related to what your hip is doing. The midfoot is so related to what your knee is doing. So when we look at the last of the MBTs, or the sole last, if you draw an imaginary line up the center of the heel and come off, it comes off on the third and fourth metatarsal. That's a true curved last. The last on the new MBT, the lower profile MBT, is straighter, but it's a more narrow base of the midfoot. The more narrow the base, the less control you have in the shoe, or the more unstable. Now, when we compare the last of the MBTs to the last of the Chongqi, you can see that the MBT is a more curved last than the last on the Chongqi. So that's one of the reasons why the Chongqi is more stable. Now, putting him in the Chongqis, the 15 degrees, standing on the left, no shoes. The Chongqis on the right, you can see the difference in the head. It's not lunged as far forward. His neck, his head is actually further back around over the trapezius and the cervical area. His elbows are much better in alignment in relation to the pelvis. And the buttocks is much better in alignment of the posterior heel. So that means that we decrease some of the flexion, and his pelvis has actually rotated more in a vertical postural alignment. From the anterior view, it does decrease some of the lateral curvature of the spine. You can look at the shoulder positioning. The shoulders are more level than the shoulders without shoes. And especially looking at the right pec versus the left pec, it is not as dropped. They're more in alignment. Now, in comparing, looking at from a lateral view with the Chongqis on the left and the Chongqis on the right, I like the Chongqi better, and he felt more comfortable. Look at the buttocks down to the back of the heels, and the buttocks down to the back of the heels of the MBTs. So he has a little bit more flex. But we do know that the MBT is unstable versus the more stable shoe of the Chongqi. But you see the difference in the head alignment, even the chest and the thoracic area, and the degree of flexion at the waist is better. Now from the lateral curvature, you can see that it is worse with the MBTs and it's straighter with the Chongqi. And I urge you to do this. Take pictures and start your own case studies. It's amazing what you will see. Plus, on the MBTs on the left, you can see on the left hand how much closer he has to stay to the body to regain stability, and how much further away the hand is with the Chongqi. Now, looking at his footprint, the scans, you can see the deviation of the hind foot, and from the forefoot, so I know there's a lot of hip rotation, but there's more hip rotation on the right, static and dynamic, pressure on the medial aspect, and there's more weakness in the thoracic area on the left. So that relates to that curvature. The right hip rotates, the left thoracic side has a great deal of curvature or spasm. And so by taking this to the chiropractor that he was seeing, they were amazed that we were able to pick up that I saw this on his footprint and scan. So instead of them isolating all of their work and focusing in on the left side, which is the affected side, they focused and adjusted the right side, which gave him relief. So looking at the Chongqi anti-step in comparison, on the left with no shoes, on the right, the anti-step. Now with the anti-step, he felt like there was more control. He felt more relaxed. He didn't feel like that he was completely off balance than he did with the Chongqis and the MBTs. So when we look at him anteriorly and the lateral curvature, we do have a little less, but the hands are contracted. You can see the difference in the shift of the hands. If I dropped a plumb line down the center of his body, I still don't like the way this right foot deviates. Now remember, I'm just looking at the shoes. I do not have orthotics in his shoes. So let's look at the hind foot with the, and this is the Chongqi 15 degrees on the left. I'm looking at the alignment of the Achilles over the base of the heel, and I like that. This is not the Chongqi anti-step. This is the MBT on the right. And I'm sorry, that's wrong. But you can see more of a valgus and a midfoot breakdown on the right and the left bilaterally, but a less hindfoot control. So there again, I know that with his back, I need more control when I have that much curvature in the spine. So people with scoliosis and things along that line, you might want to have more hindfoot control and firmness than you would softness. Here again is, on the left is the MBTs, on the right is the anti-shock. And if I drew a plumb line down the center of his body, you can see that the anti-step is much more stable and really induces postural alignment than the MBTs do. So looking at the extensibles, which is an unstable rocker sole, you can see that his hips are way behind the heels much more than the Chongqis. Now comparing the Chongqi with the extensibles, you can see that the hip on the Chongqi is directly over the back of the heels, and the hip of the extensibles is further back, which makes the pelvis more unstable. So the straighter you can be, the more stable and more secure the mechanics will be. So anteriorly, it does not help a whole lot with the curvature. Slightly it does. About the same as the MBTs. So looking at the anti-step and the extensibles, about the same with the hind foot. But the hind foot is softer than the anti-step. Now when we look at the sole of the extensibles, extremely curved last versus the Changqi, a straighter last. So there again, the sole last will tell you what type of foot this needs to go on, okay? So it was interesting to me to compare the shoes that he was in, the Keen, K-E-E-N sandals. I just wanted to look at the positioning of him, and you can see from the anterior view with the Changqis on the right, it is much straighter. I like the center line much better and the positioning of the shoulders. And he said that even with his Changqi, with his King sandals on, he felt a lot more secure in the Changqi 15 degrees. So therefore, I hope that I brought you some information that you can take and use. And please forgive me for messing up initially. And I will open up the session now for questions. Are there any questions that I can help you with? If not, I hope that everybody, I hope I see you soon. I'm very proud of you. God bless you all. Keep up the good work and keep making a difference in people's lives. Thank you very much.
Donna?
Yes.
Hi, this is Elaine from the Shelby Township store.
Hey, Elaine.
I have a question about the new, PW Miner's coming out this fall with some new rocker shoes.
Yes.
Have you seen them, and what do you think?
I think they're very good. I do. And they will fall into the stable shoe category.
Thank you.
You're welcome. Any other questions?
Hey, Donna, this is Mike Smith. I was just wondering if we could get some point of sale analysis. I was really interested in a couple of them. One would be the list of these shoes and which ones are unstable and which ones are stable, because we need all the information we can get, particularly about Skechers, with the amount of people that walk in our doors and say, you know, do you carry Skechers? And
exactly.
when we try to explain to them the difference between the shoes, the more material we have, the better.
Exactly.
And I think if you all don't do something, I'm going to make one up anyway. But just to list all of these brands, and then just a very simple thing: which ones are unstable, which ones are stable, and what's the difference, and why would that be a concern to the consumer?
Okay. Okay. I think that it would be beneficial. That's one of the reasons why I wanted to do this presentation along with Ray, and Bobby wanted me to address these issues. So what I have done now, this is me looking at all the shoes myself and placing them into the categories. Now, a lot of the research that has been done, we're going to have more research at the end of June. So I know that I will have more information, you know, for you. But as of right now, what I would suggest you doing is getting a Skechers shoe as a sample to have there to show the softness of the midsole and the incorrect pitch. Now, let me say, the Skechers shoe does help a lot of people, but so would a more controlled shoe and addressing their foot needs, because we're going to see more biomechanical issues over a long term with the Skechers and the Avon shoes because of the lack of support and the decrease of the angle of dynamics that is inappropriately aligned underneath the joint structures.
That's a good idea.
So, I would suggest doing that. I will be glad to send you information that I have. That's no problem. I know that Tracy and Bobby will all have access to a lot of this, and Dr. Bill. So I will be glad to help you in any way I possibly can.
Thank you, Donna. You did an outstanding job.
Hello.
Well, thank you so much. Thank you. Take and do your own studies and look at this. I think this is just the tip of the iceberg, but I'm telling you, rocker sole technology is very beneficial if it's appropriately addressed. And that's, you've got to do a foot assessment first.
Hello, Donna.
Yes.
Yeah, this is Clayton at the Hamilton store, and just in response to the Skechers,
Yes.
I found out that they're using just an EVA, which is really it's not going to last. I mean, it's just going to compact really quickly, and like you said, just long term, it's just going to cause more biomechanical issues to the people that are actually wearing it. So that's definitely something that they could use or to combat why the Skechers is not really a comparable shoe to either the Chungshi or the MBT or whatever.
Or the Anti-Step. It is not, or the Joya. It is not comparable.
Right.
It is a very cushioned shoe that offers slight rocker sole effect, but the mechanics of the shoe does go against some of the properties of 4-foot toe off.
Right.
So that's where that type of technology does affect all of us as far as feeling positive or negative about this type of technology. I've always been an advocate of a low-profile rocker effect, heel-to-toe rocker, always. Anything, I think what we've done, we've tried to exaggerate the point of heel rocker, and a lot of people cannot stand that degree of rocker effect. So that's where you've got to be careful, and I know that Chungchi is coming out with a 12 degree, my understanding, and I think that will be very comfortable for a lot of your people that you have been skeptical of putting them into rocker sole technology.
Okay.
Any other questions? Thank you, everybody. Good luck.
Thank you, Don.
Bye-bye. Bye-bye.
Thank you. Please stand by.